All right, everyone, welcome back for our final presentation on the skeletal muscles. This is going to be a little bit of a different lecture presentation as we're not going over PowerPoint slides in particular. This lab video will cover the muscle chart that contains the origins, insertions, and actions of some of our skeletal muscles. You will find this chart posted under the module section on Canvas right below the lab manual sheets. By now, you should be feeling fairly comfortable with skeletal muscle identification. Skeletal muscle identification specifically will be one of the most important concepts on your final exam. But along with skeletal muscle identification, you will have the origins, insertions, and actions of certain muscles as well. So this final document that we'll be covering in regards to the muscular system has 3 pages associated with it. And I want to give you a couple words of assurance that you do know, in fact, most of the information on this document already. This first page that we see here is primarily just covering the different muscles that we have and what groups they fit within. We will just take a quick second to review these different groups and the muscles that can be found within each. And on the second and third page, you'll find the table that will discuss the origins, insertions, and actions of some of the muscles that we've learned up until this point. While the second page is filled with information, the third page does not have too much extra information on it for you. So it is typically at about this point in this presentation when students start to look at me and start to wonder how I expect you all to learn these different origins, insertions, and actions. But if that student is you, I really want to assure you that most of the information presented in this lecture video will be information that you either already know or is deducible from the information that you already know. The one requirement for this, however, is that you have to know your skeletal muscle identification. You have to be able to identify these muscles on a picture, and from there we can start to deduce the origins, insertions, and actions of each individual muscle. So let's first just do a quick little review on the different muscle groups that we have and the muscles that were included within them. So specifically, the head and the neck contains 6 muscles. The orbicularis oculi muscles, which are found around the eyes, we have 2 of these, and the orbicularis oris, which is found around the mouth. Each of these muscles are named because they're circular in their shape, and the circular arrangement of that muscle will wrap around a unique location. We have the masseter muscle, which can be found in the cheek. That's going to be a muscle of mastication. We'll find the temporalis muscle that's found on the side of the head, covering up the temporal bone, and the zygomaticus muscle that sits just above the zygomatic bone. These are the 5 muscles of the head. The one muscle of the neck that you need to be aware of is the sternocleidomastoid muscle, which is named based on its origins and insertions. Moving on to the chest and the back, we had quite a few more back muscles than we had chest muscles. In particular, there were only 3 muscles that could be found on the chest: the pectoralis major, the pectoralis minor, and the serratus anterior muscle. Pectoralis major is the largest muscle that can be found on the chest, specifically in the pectoral region, and pectoralis minor was the smaller version of the muscle that's found in the same place. Serratus anterior gets its name because it courses around the anterior side of the body, and its unique arrangement of insertions makes it look rather serrated, as it inserts at many of the different ribs. Those are the 3 chest muscles. But on the back, we could see quite a few more. We have the trapezius muscle, which was roughly trapezoidal in its shape, and is one of the most superficial and largest muscles that can be found on the back. We also have the deltoid, which could be found on the shoulder, and the Latissimus Dorsi, which originated down the center of the back and has its insertion up on the arm. We'll discuss the origins and insertion of the Latissimus Dorsi later on in this presentation. We also had the levator scapulae muscle, which is named based on its action to elevate the scapula. We can't forget rhomboid major, rhomboid minor, and the teres major muscles that can also be found on the posterior side of the body. Now, aside from these back muscles, we also had the rotator cuff, and these muscles were found very closely associated with the scapula bone. We had the supraspinatus muscle and the infraspinatus muscle, which were superior and inferior to the spine of the scapula, respectively. We had the teres minor that sat just under the infraspinatus, and the subscapularis that was found on the anterior side of the scapula. The subscapularis is the one anterior rotator cuff muscle that we have. Together, these 4 muscles make up the group known as the rotator cuff. And we can consider the rotator cuff collectively to be held under the muscles of the back and the chest. As we make our way down the arm, we have the biceps brachii, the triceps brachii, and the brachialis muscle. The triceps brachii is found more posteriorly, and the biceps brachii is found more anteriorly. Both of these muscles are named based on their location and the amount of origins that they contain. The brachialis muscle is found on the distal part of the upper arm, and it's typically covered up by the biceps brachii. So it'll be much more difficult to see this muscle unless the biceps brachii has been removed. As we will further move our way down the arm, we get to the forearm, where we will find 8 muscles. 3 extensor muscles, 3 flexor muscles, and 2 miscellaneous muscles that can be found on the lateral side of the arm. The 2 miscellaneous muscles are the brachioradialis and the pronator teres. The brachioradialis will be the biggest of the forearm muscles, and the pronator teres will be the smallest. Based on the name of this muscle, we know that it pronates the forearm. Now the 3 extensor muscles are the extensor carpi radialis muscle, the extensor carpi ulnaris muscle, and the extensor digitorum muscle. The extensor digitorum is found in between the extensor carpi radialis and the extensor carpi ulnaris. Specifically, based on its name, we know that the extensor digitorum will help us to extend the digits. The extensor carpi radialis is found on the thumb side of the extensor compartment, and the extensor carpi ulnaris is found on the pinky side of the extensor compartment. We can remember these based on where the radius and the ulnar are found. Now in the flexor compartment, we have the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. The palmaris longus is found in the center and courses its tendon all the way down to the palm of the hand. And on the medial side, we'll have the flexor carpi ulnaris, and on the lateral side, we'll have the flexor carpi radialis muscle. In my experience, the forearm muscles do tend to give students a difficult time, so make sure that you're feeling very comfortable with each of these forearm muscles. So the next group that we're going to review are the abdominal muscles. There's 4 in particular that we have making up the abdominal wall. We have the external oblique and the internal oblique. We'll find the rectus abdominis in the same plane as the internal oblique, and the transversus abdominis that can be found just deep to those other 2. Now what's unique about these abdominal muscles is their muscle fiber orientation. Based on the orientation, we can determine which muscle we're looking at. The muscle fibers of the external oblique will course from superior lateral to inferior medial, while the muscle fibers of the internal oblique will course just the opposite. They will course from superior medial to inferior lateral. The connective tissue of the internal oblique will also be shared with the rectus abdominis. The muscle fibers of the rectus abdominis will course from superior to inferior. And that leaves the transversus abdominis, whose muscle fibers are going to course from lateral to medial. So therefore, each of these muscles have a different arrangement of the muscle fibers, and based on that arrangement, we can determine what muscle it is that we're looking at. We also have the gluteal region, which had 3 muscles in particular: the gluteus maximus, the gluteus medius, and the tensor fasciae latae. The gluteus maximus is the largest muscle that can be found on the body, and the gluteus medius is just smaller than the gluteus maximus. The tensor fasciae latae was found slightly more anteriorly than the rest of these are, and it is on the tensor fasciae latae that you rest your latte when your arms get tired. Lastly, as we start to move down the leg, we'll find that there's quite a few groups that can be found on the upper leg, and we have 6 muscles that can be found on the lower leg. The upper leg in particular is separated into 3 groups: the adductor group, the quadriceps, and the hamstrings. The hamstrings are found posteriorly on the back side of the leg, and the quadriceps are found on the anterior side. The adductor groups, based on their name, tell us that these muscles are going to be found on the medial side of the leg. Now the sartorius doesn't fit within any of these other groups. It will simply course from superior lateral to inferior medial above the quadriceps. The quadriceps in particular contain the rectus femoris, the vastus intermedius, the vastus lateralis, and the vastus medialis. Our 3 vastus muscles and the rectus femoris will compose the quadriceps group. The hamstrings in particular are going to be made up of the semimembranosus, the semitendinosus, and the biceps femoris from medial to lateral. The adductor group contains the pectineus, the adductor longus, the adductor magnus, and oftentimes we consider the gracilis to be in this group also based on its location. The 6 muscles on the lower leg include the tibialis anterior, which is found in front of the tibia based upon its name, and just laterally to the tibialis anterior, we'll find the extensor digitorum longus. This muscle is named very similarly to its equivalent on the arm, but we must remember that down here on the leg it's the extensor digitorum longus, and up on the forearm we just call it the extensor digitorum. We'll find the fibularis muscle, which is laterally located where the fibula can be found, and then as we make our way to the back side of the leg we have the soleus and the gastrocnemius. Our last muscle in review is the flexor digitorum longus, which will aid in plantar flexion. So by now, you should be very comfortable with each of these muscles that I've just introduced once again in this document. Hopefully this will be helpful to you to keep all of the muscles that you need to know in order. Now we're going to move down to the second page and start discussing the origins, insertions, and actions of some of the muscles that we've learned in the past weeks. So before I get started on individually explaining the origin, insertion, and actions of each of these, I want to give you all an introduction and hopefully some words of encouragement to why specifically you'll have a leg up on this material if you've already learned the skeletal muscle identification. So in particular, we know that the origin of a muscle is the attachment to the immovable bone, and the insertion is the attachment to the movable bone. Well, one thing that we know about muscles is that muscles only shorten in their length. What produces a shortening in length is the contraction of a muscle. So knowing that information, we can use that to our advantage to determine where the origin and insertions roughly are on the body. Based on being able to identify each of these muscles on the body and knowing generally where they're found, you can see the rough areas where these muscles are going to attach. So I'll use the biceps brachii as an example for what I mean. Despite the fact that the origins and insertion of the biceps brachii are listed on this page, one thing that you already know about the biceps brachii is that it's found on the upper arm, specifically on the anterior side. We know that muscles span joints, and oftentimes they span more than one joint. This is with the purpose of moving our bones around. So simply just by being able to identify where the biceps brachii is, we know that the origin is going to be somewhere up on the shoulder, and the insertion is going to be somewhere down at the elbow. We cannot tell the exact location just by looking at the biceps brachii, but you can have some indication of where those origins are found at. So hopefully as we go through these origins and insertions, you'll be able to imagine the muscles actually attaching to the bones in these locations. Now once we have learned the origins and insertions of a particular muscle, and we know exactly where that muscle attaches, that will give us the information about what the action of that muscle is. If, for example, our origin is up here on the scapula at the coracoid process, say, and the insertion is down at the radial tuberosity, when that muscle shortens in length, that's going to shorten the distance between the radial tuberosity and the coracoid process. When we bring the radial tuberosity up closer to the coracoid process, that's a flexion of the forearm. Therefore, we can deduce the action of a muscle based on where their origins and insertions are. And we can have a fairly strong idea of the general area of the origins and insertion based on the skeletal muscle identification. So hopefully, as we go through these, you're able to make these connections that I'm referring to. This chart is organized in alphabetical order. However, I am going to be jumping around just a little bit so that I can go top down. So without any further introduction, I'm going to go ahead and jump in to our first muscle, and that is the pectoralis major. Now the pectoralis major is found on the anterior side of the chest. It is a chest muscle. And when we see the pectoralis major, we can see its origins will course along the clavicle and the sternum, and its insertion will travel over to the shoulder. Right there, that gives us quite a bit of information about the pectoralis major. So you can see the origins in particular are on the clavicle, the sternum, and the costal cartilages. The costal cartilages will be found under the pectoralis major, so therefore this muscle will attach at those locations. We say that the pectoralis major originates from ribs 2 through 6, however this number does vary. But I want you to have a generalized idea of where the pectoralis major will originate from. Now the insertion of the pectoralis major is a bit more simple. Specifically, it inserts at the greater tubercle of the humerus. So muscle attachments will require us to pull back a little bit of information from the skeletal system in particular. We will see that some origins and insertions will be found on some of the very bone markings that we discussed during the skeletal system. So the greater tubercle was laterally found on the humerus. Therefore, the pectoralis major has to cross over the anterior side of the humerus, and that's going to give us the action of the pectoralis major. So we now can see that the pectoralis major is going to attach over at the sternum and the clavicle, and it's going to course all the way out to the greater tubercle. So therefore, when the pectoralis shortens in its length, that's going to pull the arm more medially, and that is what's known as an adduction. The pectoralis major will facilitate adduction of the arm, and it will also help for medial rotation. Based on the location of that insertion, that's going to give us even more information about how the pectoralis major is going to do its job. Despite the importance of the origins, I really tend to stress the insertions because the insertions tend to be a bit more specific and you can get a little bit more information from them. As the pectoralis major is a fairly large muscle that has lots of muscle fibers that are arranged in different positions, the pectoralis major is going to have lots of actions. The pectoralis major will also facilitate flexion of the arm. So all of these actions that we see can be deduced by knowing these origins and insertions. I do want you to have a good idea of what these actions, origins, and insertions are. But in the case that you get onto the exam or one of the quizzes and you don't know the answer to one of these questions, if you attack these questions in the ways that I recommend, you can really logically deduce quite a bit about these muscles. So the next muscle that we're going to discuss is the biceps and triceps brachii muscles. We'll discuss the biceps brachii first. So the biceps in particular has two muscle origins. That's what the word biceps means. Specifically on the scapula and the coracoid process of the scapula will be the origins of the biceps brachii. We're finally seeing a purpose of this coracoid process after all this time. Now the biceps brachii will only have one insertion, and that is at the radial tuberosity. The radial tuberosity was a bone marking that we learned with the skeletal system. The radial tuberosity is found on the proximal side of the radius. So therefore the biceps brachii will span the shoulder joint and the elbow joint. And that gives the biceps brachii the ability to make movements at either of those two joints. So based on the origin and insertion of the biceps brachii, we know that this muscle is passing from the shoulder down to the elbow. And so when this muscle shortens in its length, that's going to help us to flex the forearm. One other piece of information that we can use to deduce what a muscle's action is whether or not it's an agonist or an antagonist. The next muscle we're going to discuss is the antagonist to the biceps brachii. So we'll see that actually, before even looking at the origin and insertion, if this muscle is an antagonist to a muscle that flexes the forearm, the triceps brachii will extend the forearm. Now you can also deduce this from its origin and insertion, but by knowing that the triceps brachii is the antagonist to the biceps brachii, you will know that the action of each of those muscles will oppose the action of the other one. So if the biceps brachii flexes the forearm, the triceps brachii is going to extend the forearm. So more specifically, we will see three origins. Now in particular, there's two origins on the scapula and one origin on the humerus. We're not going to go into those specifically, but you will know that based on its name that the triceps brachii will have three origins. Now its insertion here is a bit more specific, and I really want you to focus on this insertion in particular. The insertion of the triceps brachii is on the olecranon process of the ulna. So we can think that if the triceps brachii is also originating up at the shoulder and traveling all the way down to attach at the ulna, when the triceps brachii shortens in its length, that's going to pull the olecranon process and extend the forearm. So by knowing the origin and insertion of the triceps brachii, we can deduce what the action is. But again, an easier way to do this is by knowing the action of the biceps brachii and understanding that this is its antagonist. So our next muscle up will be the deltoid muscle. The deltoid in particular has several origins, but once again, it's only going to have one insertion. We're starting to see a trend that these insertions are a bit more specific, so I really want you to focus on the insertions in particular. The deltoid originates in several places. It's going to originate at the clavicle, but it's also going to make its way around the acromion process of the scapula and insert down the spine of the scapula. So in fact, the deltoid's origin is quite large, and we just include all of those places that it attaches to. Now down here, the insertion of the deltoid is fairly straightforward. The deltoid will attach at the deltoid tuberosity on the humerus. Where do you think the deltoid tuberosity gets its name? So therefore we can see that the deltoid attaches in the acromial region of the shoulder, it attaches at the superior aspect of the shoulder, and it's going to insert at the lateral side of the humerus. Therefore, when we contract the deltoid, that's going to abduct the upper arm. That's going to help us to pull our arms outwards, away from the midline. Hopefully by now you're getting the hang of seeing how these origins and insertions lead to the actions. The next muscle we're going to go over is in fact a group. We're going to discuss the rotator cuff muscles next. Again, that's supraspinatus, infraspinatus, teres minor, and subscapularis. All of these muscles will originate at different places on the scapula. In particular, the supraspinatus will originate from the supraspinous fossa, and the infraspinatus will originate from the infraspinous fossa. However, you just need to be aware that the scapula is where all of these rotator cuff muscles originate. And they will all, in fact, have the exact same insertion as well. They will also attach at the same place that the pectoralis major did, at the greater tubercle of the humerus. Therefore, since these muscles use the exact same insertion as the pectoralis major, they're either going to oppose or aid the pectoralis major in its actions also. The rotator cuff in particular is given its name as a group because it will be responsible for the rotation of the humerus in different ways. Both medial and lateral rotation are facilitated from different muscles in the rotator cuff. The rotator cuff muscles are in fact rather small, so they do serve as stabilizers and fixators to aid prime movers while they facilitate their major actions. Based on where the muscle is found originating on the scapula, that will indicate what specific rotator cuff muscles will aid in either medial rotation or lateral rotation. So now we only have two more muscles that can be found on the upper half of the body, and the rest will be found on the lower half. We will still see the Latissimus Dorsi and the Rectus Abdominis as our last two muscles that are found on the upper part of the body. So let's do the Latissimus Dorsi first. The Latissimus Dorsi muscle has quite a few origins. You can see that it attaches all the way up from T7 all the way down to L5. It's going to continue on to the sacrum and even originate at ribs 9 through 12. However, despite the extensive nature of the origins of the Latissimus Dorsi muscle, we have one insertion here with this muscle. Now this is a structure that we have not really seen so far. The intertubercular sulcus is not one of the bone markings that we learned. However, I want you all to recall that we have a greater tubercle and a lesser tubercle on the humerus. The intertubercular sulcus is the little groove that's found between the lesser tubercle and the greater tubercle. This attachment is almost in the same exact place as the pectoralis major and the rotator cuff muscles. The Latissimus dorsi muscle will actually course under the arm and attach to the anterior side of the humerus. Therefore, we'll see these actions displayed very similarly to the pectoralis major. This is also going to help to adduct and medially rotate the upper arm. Since the Latissimus dorsi muscle is found on the posterior side of the body, that's also going to help us to extend the arm as well. Now, the Latissimus dorsi is quite different from the pectoralis major. Their origins are entirely different. They only share the same insertion. So that's going to indicate that they may have some of the same actions, but everything is not necessarily going to be the same. So you'll see that based on the location of this muscle, that the Latissimus dorsi will also help to pull the arms inferiorly and posteriorly. The pectoralis major, of course, won't be able to do this since it's found on the anterior side of the body. Now, our last muscle here on the upper half of the body is the rectus abdominis. The rectus abdominis originates at the pubic symphysis and the pubic crest. Now, we have not heard of the pubic crest before, but it's found right next to the pubic symphysis. Specifically, the pubic crest is found on the pubis bones. Now, based on where this muscle is found, we know that it's found on the abdominal region. It's going to course all the way up to ribs 5 through 7 and also attach at the xiphoid process as well. So understanding that we have muscle fibers that are coursing from the lower part of the rib all the way down to the pubic area, when we contract that muscle and shorten its length, that's going to help us to flex the vertebral column. And based on the type of the muscle contraction that we see, this can also compress the abdominal contents. So that will conclude the muscles of the upper half of the body. The muscles on the lower half of the body that we're going to discuss are the quadriceps, the hamstrings, and the gastrocnemius muscle. We know that there are 4 quadriceps and 3 hamstrings. However, these muscles in particular are all found originating and inserting at almost the same locations. So we'll see that their actions are virtually the same. We'll go ahead and start here with the rectus femoris, and you'll see that the rectus femoris in particular will have almost the exact same origin and insertions as the vastus muscles, as they're all part of the quadriceps group. Therefore, their actions are also going to be the same. What we can also deduce from this is that the hamstrings are antagonists to the quadriceps. So the actions of the hamstrings will oppose that of the quadriceps. Let's break down the rectus femoris and the vastus muscles now. So the rectus femoris is the largest of the quadricep muscles. Specifically, this is the one quadricep that will actually span two joints. All three vastus muscles will only span one joint. So the rectus femoris is going to originate from the ilium and insert all the way down at the tibial tuberosity. This muscle will do this through the patellar tendon. Now, knowing that the rectus femoris will originate from the ilium and insert down at the tibial tuberosity tells us that this muscle spans the hip joint and the knee joint. Therefore, because this muscle spans two joints, it will have two actions. Its first up here at the thigh is to flex the thigh, and its second is to extend the knee. Based on the location of this muscle, if we were to shorten it out, that's going to pull the knee closer to the chest, but also straighten out the leg. This is going to be the action of our quadriceps. But you'll see down here that the vastus muscles do not quite originate as far up the leg as the ilium. These muscles only go to the upper part of the femur. So in fact, the three vastus muscles will only span one joint, specifically the knee joint, but they will insert at the exact same place as the rectus femoris. So all four of the quadriceps insert at the tibial tuberosity, and the rectus femoris is the one that will originate up on the ilium. The three vastus muscles originate down on the femur. So since the vastus muscles only span one joint, they're only going to have one action. Therefore, these will help the rectus femoris extend the knee. But they will not play any role for the hip. That is strictly for the rectus femoris to do. So we can see that flexion of the thigh and extension of the knee is the goal of our quadriceps group collectively. If we see now the semimembranosus, the semitendinosus, and the biceps femoris muscles, they will have the exact opposite actions as the quadriceps, since the hamstrings collectively are antagonists to the quadriceps muscles. Let's take a look at the semimembranosus and the semitendinosus. These are two of my favorite muscles because the semimembranosus and semitendinosus have exactly the same origins and exactly the same insertions, which implies that they will have exactly the same actions as well. So the semimembranosus and the semitendinosus will attach at the ischial tuberosity. They'll course down to the backside of the tibia, and therefore they're going to span two joints, the hip joint and the knee joint, which gives them two actions, flexion of the knee and extension of the thigh. So these muscles' action are exactly the opposite as the rectus femoris. The rectus femoris will flex the thigh and extend the knee, while the semimembranosus and semitendinosus will flex the knee but extend the thigh. So these are going to have exactly the opposite action as our quadriceps. Now moving up to the biceps femoris, we have to remember that this is a biceps muscle, so this will have two origins. Therefore, we have the femur and the ischium as locations for muscle attachment. Based on its lateral location, the biceps femoris will in fact insert down at the tibia and the fibula, where those two bones come together. And this is based on its lateral arrangement. But the action of this muscle is no different from the semimembranosus and the semitendinosus. They all do exactly the same things. So again, if on the exam you get lost, you can think about what the antagonists and agonists of these muscles are, and that might help you to deduce the correct answer to a particular question. The last muscle that we're going to be covering in this presentation is the gastrocnemius muscle. The gastrocnemius muscle has two heads and therefore has two origins. The gastrocnemius will originate at both the lateral and medial condyles of the femur, and it will course all the way down through the Achilles tendon and insert at the calcaneus. One thing we'll see about the gastrocnemius is that this muscle will also span two joints, the femur all the way down to the calcaneus. So this muscle is going to span the knee joint and the ankle joint. Therefore, we get plantar flexion of the foot and also flexion of the knee from the gastrocnemius in particular. So with the gastrocnemius, that concludes our last presentation on the muscular system. Now that we've spent some time with muscle identification, it's time to take the next step and look into the individual origins, insertions, and actions of some of the muscles that we've seen. Again, I just want you to keep in mind that by knowing the skeletal muscle identification, you can get some insight about the origins and insertions, and by knowing the origin and insertions, you can determine what the action of that muscle is. This will conclude our topic of the skeletal muscles. I will see you all in the next lecture video when we will cover the brain.